Hello, we're Healthwatch Suffolk and we're here to improve your health and social care services within the county. And today we're at the Suffolk Show listening to people's experiences of their health and social care services.
There is a real problem just now with GP surgeries that if you have something where you need to see somebody now, you have to book and phone an emergency appointment, but often it doesn't feel like an emergency, but it is because it's something that's happening now. If you're going for a repeat something, you need an appointment in 3 weeks' time, that's fine. But for something that happens now, it's actually quite difficult. I don't like phoning and asking for an emergency appointment, but that's what I have to do. And they are wonderful about fitting me in. They are the most delightful place.
So, Healthwatch Suffolk, speak to them, they're brilliant, they can feedback and help us improve all of our local healthcare services.
So what's really important as a member of the Health and Wellbeing Board is that we get to hear what the people of Suffolk really want and really think about the health services that are being provided. So I think if we don't hear from the people at the ground roots, we can make all sorts of assumptions as so-called professionals or elected members or whatever we might be. But the really important feedback comes from the people that are actually receiving the service or not receiving the service, as the case may be.
Ended up going A&E just to make sure that I didn't get concussion. Good about it was they gave me the sort of bright sort of looking after them, where it sort of made sure everything was wiped out. The only bad thing about it was I don't really enjoy going to hospital.
As a member of the Health and Wellbeing Board, it is very important that we take the views of our residents and members of the public in terms of the health and social care that we provide on their behalf for delivering good quality, high quality public services. It's actually about providing the right care at the right time in the way that people actually want it delivered on their behalf.
The Coffee Caravan are really pleased to be able to work with Healthwatch because obviously we listen to a lot of people talking to us about their health and social care experiences, and we're able to feed back to Healthwatch knowing that what we're telling them will actually affect a change, because Healthwatch having the law behind them, people delivering these services will actually have to listen to what they say, and they can make definite improvements. So for us, it's an ideal partnership.
Obviously I was diagnosed with a problem with my neck, but the service and nurses, I couldn't fault them, and my experiences of the appointments weren't, not bad, and while I stayed in hospital, the food I had, I couldn't complain about it either. So.